Joining us now, Congresswoman Maxine Waters on the line. Congresswoman, how are you?
I'm fine. How are you?
Fine. Always good to talk to you.
Good.
You know, I was thinking about you this morning when we were in Selma in March, and you told the people, I think we played that clip on the air too, you told the people when they were coming to put them out of the houses, don't let them put you out. Don't let them foreclose. Don't leave your house. You said, do like we used to do. Stay in the house. If they
Well, you know, to tell you the truth, the banks are letting them sit there and deteriorate. They stay boarded up for months, sometimes years.
That's right.
And
they won't do anything with them anyway.
What they ought to be doing is, if people can't afford to pay their mortgage, they ought to work out some kind of rental agreement with them and let them stay in the house.
That's right. That's because the banks can't do anything.
So, yeah, I would advise people to stay.
Well, I brought that up on this just to point out how you are always, of all the members, you are always on point. And then we get back, and then you remind us that these problematic blue dogs were partially, if not completely, Frankenstein's created by Rahm Emanuel himself.
That's right. That's right. And I told him, and now the chickens have come home to roost.
Haven't they? Haven't they? And so where are we now on this public option? You support, I support. Of course, I know you probably support the Conyers bill. It's a shame that didn't happen. But
well, it's a shame that didn't happen. That's the single payer, which we just couldn't even get up in committee. It didn't stand a ghost of a chance, but we went with public option. So we feel like we have compromised as much as we can possibly do.
Sure.
We can't go any further. We've got to have the public option. It's the only thing that's going to create competition with these insurance companies. These insurance companies, these health insurers, have been getting away with murder. They have ripped the people off. The top 10 CEOs make $10 million or more. And the CEO over at Aetna, the biggest, makes $24 million a year. So they're not putting the profits back into health care. As a matter of fact, they're denying people with, as you know, with pre-existing conditions. And if you are paying your premiums, they even start to pay for your health care if you got cancer or AIDS, and it starts to cost them too much money. They kick you out. They stop covering you. So we've got to have a strong, comprehensive, universal health care bill with a public option, and that option will create competition. This is what the insurers don't want. This is what they're spending so much money against, organizing and orchestrating these town hall meetings, because they don't want the competition. They want all this money. We have 47 million people who are not insured, and if we mandate insurance, they get to do all the business for the new 47 million if there's no competition.
Now, how are we doing in terms of realizing the public option, though, Congresswoman Waters? There's been a lot of back and forth. I'm a little nervous.
You should be nervous.
I've talked to some other colleagues of yours who say this ain't looking too good. I mean, where are we?
Well, you should be nervous because already the Senate has all but said they're not going to support a public option. And, you know, in my town hall meeting, I called them Neanderthals, and it got all kind of play. There goes that Maxine Waters again. But the idea that they would be on the side of the insurers rather than on the side of the people is just something that is hard to digest and hard to understand. Now, some of our members got scared. They got attacked, verbally attacked, in these town hall meetings. As you know, when the president did his kind of town hall meeting, guys showed up with guns on and all of that, so there's some intimidation going on out there. And some of them who thought they would be for public option may be backing up. But we can't give up on it, because one of the things that happened is after the town hall meeting outburst and disruption they started to escalate. They even went against some of the blue dogs and the Republicans. So that should show them that they can do everything that they want to do to try and get the favor of the insurance companies who's helping to undergird this thing, that unless the insurance companies get completely what they want, they're going to be against them too. So we've got to fight. The president must stop pursuing the Republicans and the right-wingers. They're not going to support it. We've got to do it with our majority numbers. We can pass it. We got the numbers to pass it out of the House. The Senate is more difficult. We've got to get Kennedy's replacement. as quickly as we can. Patrick Duvall, the governor up there in Massachusetts, is trying to do that based on a request from Kennedy, and we got to go for it. We got to fight them. We've got to make this the fight of our lives. And the president, who has been a little bit ambivalent, I would say, about it. At one time, he said it was very, very important. He was going to make sure that there was a public option. But then when he came out and said, well, this isn't the most important thing, it's just a sliver, it sent everything into a tailspin. But thank God for you progressive journalists. You guys really did a pushback on it. All of the talk shows, radio and TV progressives really hit it hard. And I'm very pleased about that we have so many progressive journalists who are saying this public option makes good sense. So we got to fight, and we can't walk away. We cannot be intimidated. We cannot fear that somehow if we don't do it, we won't get anything. That's not a rational argument at this time.